On behalf of National Hemophilia Foundation, welcome to Basics Track, communicating with your providers, telehealth or in person. My name is Erica Bailey, Manager of Education at NHF. For privacy purposes, please join us in renaming your screen by hovering over your image and clicking on the dots there and renaming it with your first name only in your category, such as consumer. We'll go ahead and review about getting the most out of your session. So please use our Q&A feature, our chat box, to write any questions or comments that you might have. We will try to respond to as many as possible at the end of our session. This presentation will be recorded and will be available to watch online as well. And here are our speakers' disclosures. Now, let's go ahead and start our session, communicating with your providers, telehealth or in person. At this time, I would like to introduce Ed Keebler.
Thank you, Erica. That was perfect. Well, it's an honor to be moderating this session with this amazing group of people, and I'm excited to have been asked to do this. Just a little bit about me, some highlights. I've been in the bleeding disorder community for about 30 years, with 20 of them at the treatment center in Houston, Texas. I retired just a couple of years ago and currently working with Global Blood Disorder Foundation. And I also am a board member and conference co-manager for the VWD Connect Foundation. I'm a past psychosocial committee chair for the World Federation of Hemophilia. And I had the good fortune of being Social Worker of the Year with NHF back in 2007. So it is a pleasure for me to still be involved and working with our community. And once again, I very much appreciate the opportunity to moderate this really terrific session. Thank you. Thank you, Erica. It's nice to be with you all, and I appreciate being asked to be a moderator on this hopefully very educational session. We have three really good speakers, presenters from the treatment centers, and hopefully it'll give you a perspective of the whole idea of communicating with your providers, telehealth or in person. I'm going to start with Dr. Bryant, and I have a question about how you can, or what is the most helpful for you to do for your patients to get prepared when they come to the treatment center?
Well, when the patients are coming to the treatment center, the best thing they can do is figure out what are their questions and what they would like to achieve. And those things are, you think are basic, but a lot of times there's so many things that go on in your life, you have to focus on what do you really want to get out of that visit. You want to make sure you bring your medicines. Not factor if it has to be refrigerated, but if you have other medicines, you need to bring those with you. If they have questionnaires or surveys they want you to fill out, bring that. And if you've been to any other physicians that might have any impact on what's going on with you for bleeding, you want to bring that, or at least the name, so your doctor can talk to them about it. And then try to be on time and let the staff know if you need an interpreter. That may seem like a simple thing, but that can hold up your visit and make things a little bit difficult. And in this way, in this time of COVID, make sure you ask, can you bring a friend or bring other children? Because a lot of COVID policies, they do not need to be around other sick folks. I work at Novant Health, the St. Jude Affiliate Clinic, and I am the medical director for our HTC in Charlotte, North Carolina.
Very good. Thank you, Dr. Bryant. I'm going to pose the same question to our nurse on here, Jim Munn. If you could also think about the same question and give the audience your perspective. What is the most helpful for your patients to be prepared when they are on a telehealth call with you all?
Great. Well, thank you, Ed. As he said, my name is Jim Munn, and I happen to be a nurse coordinator, program coordinator at the University of Michigan's Treatment Center in Ann Arbor, Michigan. And I echo all of the things that Dr. Bryant had said. And I would also want patients to do a few things. Make sure for a telemedicine clinic that you dress appropriately for the visit. So because we want to often look at patients' joints and things like that, consider wearing a t-shirt and a pair of shorts so that we can get a full view of you, and then double check to make sure that there's no restrictions in your range of motion, things like that. We want to make sure that you have the current weight. So we would ask you to either weigh the patient or yourself the day of the clinic appointment or the day before, and just have that information ready. Want to make sure that you have copies of your treatment logs available at the time that we have our telemedicine clinic so that we can go over the times when you may have had a breakthrough bleed, check to see how you're doing on your current therapy. And then anything related to school issues, we'd like to get those forms ahead of time as well. So we'll ask you, do you need to have a new school letter? Do you actually need to have a school visit this year? Or a home visit? If we have a family of a patient that's newly diagnosed, and we've had quite a few this year, I think that might be related to COVID in some respects. But at the same time, we can do school and home visits, and we can actually do some of those virtually as well. So if you need those kinds of things taken care of, make sure you let us know at the time that the telemedicine visit is occurring. Another thing that we would want you to do is make sure that you, again, bring all the questions that you want answered. And I can't stress that enough. I am so glad you led with that one, Dr. Bryant, because oftentimes we know what we want to talk about, but what we need to know as providers is what is it that you guys want to talk about, and what is your goal for the next year or even maybe the next month. So whatever it is that you guys are interested in talking about, we want to make sure that you bring that to the table.
Great, thank you very much, Jim. And our last speaker, Javed Dallas, social worker, same question to you. When doing telemedicine with a patient, parent, or caregiver, what's the most helpful for them to do so they can be prepared?
Well, starting off, thank you, Ed. Thank you, Erica. Thank you, NHF, for allowing us this opportunity. I know that there are a lot of great providers that are across the country, and so the opportunity to get to do this. As Ed said, I am Javed Dallas. I am a social worker at the Oklahoma Center for Bleeding and Clotting Disorders, and I've been there for approximately 9 years. I had the great opportunity to work with NHF and this great staff. Going back to Ed's question, going back to your question in terms of, as we look at telemedicine, how do we take advantage of it the most? I think really the word that I would use is one of the words that you had in the question, really, which is preparation, that we would treat this doctor's appointment just as we would a doctor's appointment if they were in the clinic. Jim talked about the appropriateness of the way that we dress. Dr. Bryant talked about trying to identify what are the goals, identifying those goals in the beginning for what we want at the end. But the other thing that I would encourage families to do, or what are some of the things that have changed since you were last into clinic? Are there any billing issues that you have? I think this is a great opportunity to bring those things up. Are we looking at any school changes? Are we looking at any function changes that need to be reflected in either a 504 or an IEP? I encourage my families to take notes on questions that you have. I find oftentimes our best questions come when our treatment center staff or our doctor staff is not available to us. It's in the middle of the night. It's when we're up with our kid and things like that. And so just take notes, even if it's not physically writing it down. Nowadays, all of us, most of the time, have a phone handy. And so just taking those notes. And then the biggest thing I think is prioritizing. When we go into a doctor's visit, we're not necessarily going to get as much time as we think that we need. And so as we prioritize, what are the main pieces that if I need to call back in 6 months, or if I need to call back in a month, I can have these issues addressed. But what are the things that are going to affect us as we leave the office today? And I really think that those are as we consider how do we get the most out of the visit, I really think that those are some of the keys in my opinion.
Thank you, Jave. That's great. And if you think about this team in front of you, hopefully this information is really helpful and you're taking some notes for those of you in the audience. I have another question I'm going to ask our speakers from their perspective. So for Dr. Bryant, as a pediatric hematologist overseeing patients' care, what is the best advice you can offer for families to do in between visits? And you might be able to say something about the difference between telemedicine and an office visit, so they begin to understand there is a difference and why they're important in this time that we're doing them.
Well, they both have their place, and they're both great visits if you're prepared and you have the right technology. For instance, having great internet, or having the capability of an iPad or a computer is important in trying to figure out is a telemedicine visit or in-person visit is right for you. I tell all patients, please follow your hemophilia treatment staff orders in between. That's the best thing you could do, because a lot of times they're like, wonk, wonk. I don't know if I need to pay attention, but yes, whether it's televisit or in person, pay attention, take your medicine, record your bleeds, and call us for any concerns. The difference is if you need a personal touch, you have an exam finding that's difficult to see, you can't take a picture of, or you want to talk about something sensitive, or you're upset about something, or you just need a hug, then you need to come in and see us. If you're on a research project, that's one thing we discovered. We can't do consenting in some institutions over a televisit. You have to come in. So you may need to come in for that. If you have started a new medication or going to start a new medication, you may need to have to start that in an in-person visit versus at home. In case you have a reaction, we want to be there. If your treatment isn't working, for instance, the same thing you did a month ago and you're still having more bleeds, we want to see you. And then if it's a safe environment, or you feel safe, probably the best thing is to come in. But we can do televisits with even physical therapy. We can look at pictures. I can even look at the medicine you got and even look at the lot number and all that. So we can do a lot through telemedicine, but there's some things that we need to do in person. And in any event, any of the recommendations that you receive from your treatment team, you really need to follow them in between. And the last thing I want to tell you, if you do a telemedicine visit, one thing I find most often is you forget to make your follow-up appointment because you don't have to go by the checkout desk. So if you do telemedicine and the doctor says 3 months, if you haven't gotten an appointment in a week or so, schedule it while it's on your mind. Otherwise, you might forget and we'll have to chase you down, which we don't mind, but might be annoying to you.
That is great. Thank you, Dr. Bryant. That's really wonderful. I'm going to move over to you again, Jim, and ask the question, as the nurse managing the patient's care, what can the patient family do to keep their child's health status current with the HTC if they're reporting by telemedicine?
Thank you very much, Ed, for that question. And I have to echo all the sentiments that you just said, Dr. Bryant. I'm not even sure I'm going to be able to answer anything differently. A couple of things that we definitely want to know from a telemedicine perspective is often when you come to clinic, you know about things ahead of time that we're going to want to see. And I have to say the picture portion that you mentioned, Dr. Bryant, as far as if you can't take a picture, we won't be able to assess it very well. So if you know that, for instance, you're experiencing abdominal discomfort, that is not something that you can do very well with telemedicine. You can mention it, we can talk about things at that, but we may be requesting that you have a face-to-face visit with us. The other thing that we always want to make sure we're aware of is any pending or upcoming surgeries, procedures, including dental work, because it's those times when we need to make sure we're developing the appropriate treatment plan for you and that we've got all of the medicines that you need available in your home to take, that you know how to take them and things like that. And with the changes that have happened with some of the products not being available like they were, so for instance, nasal DDAVP, we're having to make adjustments for patients based on that. So we definitely want to make sure we know about any kind of procedures that are coming up so that we can develop the best treatment plan. A couple of other things across the country, I'm sure we've all either just experienced or currently are experiencing or soon will be experiencing things like camp, sports camps, hemophilia camp, music camp, things like that. We want to make sure that we have all the forms that are necessary to be completed by us presented. At our institution, and I'm not sure how it is for you, Dr. Bryant, or for you, Javay, at your respective treatment centers, we have an electronic medical record that has a portal where patients can actually download things for us to take care of. And we ask our patients to do that ahead of time so that what we can do is make sure we've responded to them and sent it back in time so that it's capturing and it's to them at the appropriate time so they can take it to school for camp, things like that. At the same time, we also want to make sure that we know if there are problems with your therapy or if you're not happy with the current treatment plan, or you have suggestions on things that you might want to know about, to give us a heads up on that as well. There are new therapies that are out there that people are always interested in, and we are more than happy to discuss those. We can do that ahead of time or in between visits. So anytime you have a question about those kinds of things, please give us a call. And I have to echo again what Dr. Bryant said about the issues related to bleeding events, breakthrough bleeds on therapy, things like that, because we may need to do testing to make sure, for instance, there's no inhibitor that has developed, or just to make sure that what we currently have you prescribed for is appropriate. And what we notice is during COVID, a lot of patients had weight gains that we weren't anticipating, which would have changed some of their prescriptions just based on the number of pounds that they added on. I call it the COVID-19. In any event, that those are other things that you're going to want to let us know about, especially on those medicines that are weight-based as far as the dosing strategy is concerned. And then the last thing that I would say is please keep us apprised of any changes to your address, phone number, things like that, because that we have found is a way that we've lost some patients to follow up, and they were like, why haven't you reached out to us? And it's because they had a address and or a phone change that we weren't aware of. And when we finally get a chance to reach and talk with each other, it's just a matter of getting that all changed in our system so we're all up to date. And we enjoy any questions, concerns, issues ahead of clinic as much as possible. And throughout the interim, we want to make sure that we're capturing that information as well. So don't be afraid to contact us.
Great, Jim. Thank you very much for that important information. And the last question that I have for Javay, for social work involving transitioning, as the social worker working with patients and families, how can the family be involved with the patient's different stages of their transitioning process when they're reporting through telemedicine?
So Ed, as I was thinking about this, like you said, I think as social workers, not that the other team members that we're blessed with don't think about it, but I think we uniquely think about transitioning and what that process looks like. How can we find ways of touching on it at every visit? In some ways, regardless of the age of the child. But as we talk about transitioning and the whole telemedicine, as Jim talked about, one of the overarching themes I think that families, providers, parents have been dealing with is this whole burnout of being online. And so the biggest thing I think I would start with, as I was thinking about this, is I wrote this down, I highlighted it, I put it in bold. The importance of, please, parents, stay involved. And I think a lot of that comes from, as we look at our kids, as we look at grandkids, as we look at whoever loved ones that we've been blessed to take care of, oftentimes they're a lot better at technology than we are. So we give them the computer and tell them, go take care of this. We give them the iPad and say, go take care of class. We give them the remote control or our phone to say, please program this for me. But the truth of the matter is, at some point, if we become disengaged, we're modeling the behaviors that we want to see from our young people. And so I really think the most important piece, staying involved, parents, making sure that your children are doing their bleeding logs, making sure that they're actually, and not just doing the logs, but they're actually doing the infusions. If they didn't do the infusions last year and there's been no significant changes, they probably didn't learn how to do them overnight. And so I think that that's really the most important piece, because if we don't make sure that they're staying on task, it's a lot harder to get them back on task, whether it be academically or medically. So I think staying involved is the number one piece. I think the number two piece is that each one of us know our children. You know, we know the part that we present to everybody else about, oh no, my Johnny wouldn't do that. But we know the kid that we put to bed every night, and we know their responsibility level. So I encourage parents to think about, what is that end goal? We talked earlier about thinking about, when we go into that doctor's appointment, what is that end product, or what is that end question that we want answered? And so as we talk about transitioning, I often encourage parents to think about not the sweet little child that we've got right now, but who is the responsible person that we want to have at the end of this journey? And how can we take steps with them every day? Really, I use the words to invite them to responsibility, to start to take advantage of. And so these would be things like, Jim talked about making sure that you're staying in touch with your treatment center staff. If you've got a 15, 16, 17-year-old young man or young woman, this staff, they've probably built some sort of relationship with, to where they should feel comfortable enough about reaching out to a Jim, reaching out to an Ed, reaching out to a Dr. Brian. And I think that those are some of the baby steps that we can help them to take, so that as they get older, get 18, 19, 20 years old, and maybe not under our purview, then that we've started to instill those skills in them very early on. And those are things, really, whether we're talking about being in the midst of a pandemic and having to do everything through telemedicine, or like Dr. Bryant said, we need that actual warm touch. A lot of those skills are transferable both ways, but I really think encouraging them to start calling their pharmacy, or even thinking about, how many doses do I have, instead of us as parents going into the closet or going to the refrigerator, encouraging them to start thinking about what that bigger picture is. And so I think as parents, that's one of the bigger things is, continuing to stay involved. And not just giving them the keys, just like we don't trust them to wake up at 7 o'clock in the morning and make it to school. We make sure that we wake them up. We make sure that, our teenagers don't really grab breakfast and don't really brush their hair and things like that. But we at least give them the responsibility and the opportunity. And I think that it's similar when taking care of or trying to address these medical needs.
Great, thank you, Javed. Those are like nuggets of gold for parents, and hopefully for the teens themselves are listening in. They're part of this whole process, and really great answers to all of the questions. So hopefully our audience has been typing questions into the chat box, and if you haven't, please do so. And now we will take a look at what some of those questions are and see if we can answer them for you. Thank you so much. Thank you, everyone. I enjoyed that the second time watching us. It was fun recording it with everyone. But it was really impressive. That information that you all gave during our recording was really, really valuable. And I just loved watching it again. We do have one question so far that came in and possibly another. And whoever would like to answer this, or as many of you that have some information to offer, it's would telehealth visits ever be recorded is the question that came in.
I could start. I know that our institution, that's not something that we are doing at all. We are not recording any of our visits. So our families, I think, get that information ahead of time. There's actually some other information that's given to them before they sign up for a telehealth visit, Zoom visit, whatever you want to call it, that mentions things for them as well and how to get a hold of our institution if they felt that there was something wrong. So all of that is done pre the visit.
Yeah, we don't record either. Telephone calls, if they are recorded, there's a standard verbiage that goes with it. And so if you're at an institution that there is a recording, they have the responsibility to let you know. So most times that shouldn't be an issue, but please always feel free to ask if you have any concerns.
Okay, I have another question here, and I don't know if you all will know the answer to this. The question is asking, is there a difference in cost to the patient or family from a telehealth visit to an in-person visit? Would you know that? Anybody know that?
There is a difference in cost, and if you come into the hospital, there's often a facility fee. So the hospital makes, if you will, the hospital has better profit if the person is seen in person. However, if your insurance covers the televisit, it should be covered. It's usually a little bit less expensive than an in-person visit. But right now, visits are covered. The problem is that different states have different rules. So if you're a different state and you're crossing state line, it may not be covered in your state. So I always try to make sure that the authorization is obtained before the visit starts. It's a little tricky now. I know that there's a great movement to have telehealth, a standardized offering throughout the country. But right now, I think it's really important you check with your carrier because if your HTC is in a different state than what you are in, it may not be covered.
One of the other things as a social worker I would encourage people to do is, as Dr. Bryan alluded to, that there have been a lot of changes in the way that telehealth has been addressed over the past 10 years, but more specifically over the past 1.5 to 2 years with the coronavirus. And so there have been a lot of insurance policy changes that people have had. And one of the things that, and most of us have probably not looked at our insurance policies particularly, since we've started our jobs or since we've been on the particular plan that we have. And so I would encourage everyone to reach out to the member services, and that telephone number is either going to be on the back side of your health insurance card, or you can generally find an 800 number online, but then you'd still need your member ID number as well as group number and things like that. That way they could look up your particular plan and give you the specifics of what your costs are, both for out of pocket and also what the facility receives.
Thank you. I have another question.
I just wanted to add one other thing, Ed, if that's all right.
Sure. Absolutely.
What we have found, obviously, is that patients love that telehealth visits compared to having to come in, because we have patients that can drive as far as 4 to 5 hours just to come to visit us. So the cost for their visit to come from their own pockets is far less. And I do believe that going forward, we are going to see an intermix between visits. So you'll probably have at least a face-to-face yearly, but we could potentially do interim visits as virtual visits. And those may be things that HTCs will start thinking of as well. I don't think we're going to get to the place where we will do every single visit as a virtual visit, because as we've already heard from Dr. Bryant and others, that we have to see you for certain scenarios. It's not always something that can be done over a virtual visit when you have to do true assessments and things like that. But things are getting better, and we're working with families to make sure that we provide care that is helpful to them as well.
Thanks, Jim. And here's a question that kind of tags on to that, a little more personal for each of you. Which type of visit do you like the most is the question. Who wants to start with that one?
I'll start.
Okay.
So as the social worker, as the mental health person, I really love, a lot of my interaction is about body language. A lot of times the things that we talk about aren't necessarily of a comfortable nature. And so for me, a lot of my interaction is being able to read shifts in the body language as we talk about certain things, such as, a lot of times in working with teenagers, as we talk about grades or how they're getting along with their peers or dating, they may not necessarily be completely honest with their parents, especially as grades being online. A lot of times parents may not see grades until end of semester. And so as we're having those conversations, a lot of times I can kind of, read that there's something that hasn't been spoken. And so it gives me the opportunity to, ask the young person if they want the parent to be able to step out of the room. And number one, I don't get that body language when we're doing the telehealth visit. And then number two, even if the parent, allegedly steps out of the room when we're on the telehealth, we can't necessarily ensure that we're going to get the privacy that we need to talk about a lot of the issues that I find are important, but they may not necessarily be central to the bleeding disorder itself.
Yeah, thank you.
From
Who'd
my
like to
perspective,
go next?
Jim, I agree with Jave. I prefer the face-to-face visit for similar reasons. Right now, our virtual visits, the entire team sort of is ganging up on you, it feels like, I'm sure, because you'll see 3 or 4 faces all on the screen with you, and everyone's waiting for their turn to ask you their questions. And when you're face-to-face, we go in individually and we get to do our own assessments and things like that based on our professional pieces. And we have a little bit more time often to do that, because the virtual visits get scheduled to the extent that if you're running over on one, the next person is not happy that you haven't logged on with them yet. So there's that anxiety and or anticipation that sometimes happens with the next person if things start running a little bit behind. But in the clinic, we have the opportunity, if 4 patients are there, we have 4 different providers. One of the providers can be in with each of those different patients, and then we rotate from there. So that piece is a little less of a problem. And I agree, there are just things that you can discuss and do those. I like the way you expressed that, Javed, sort of the nuances that you see when you're face-to-face that doesn't get captured on a video visit as easily. And so I can tell when I ask a question if one of my kids is anxious, or if I say, you know what, it sounds like you may be getting a blood draw today. I can do anticipatory guidance right from the get-go and make sure that they understand this is, something that you've had before. We can deal with that. When we're on a virtual visit and we then say, oh, you need labs, and we're then mailing labs or faxing labs to a local laboratory facility, that piece is lost. And so that sort of falls to the parent to have to take care of, depending on how anxious someone might be. And there are times when we have to follow up just to say, hey, did you get those labs drawn? Because we haven't seen anything so far. So that's another piece that can happen from a virtual standpoint as opposed to face-to-face. The blood draw station's right at the treatment center, so you can't sort of leave the building without passing by it. So we know that most of our patients stop by and get their labs on the way out.
I like them both. I've had teenagers who in the privacy of their own space have told me about some mental health issues that I wasn't aware of. And because they were home, they could let me know. Also, young ladies with bleeding issues. I had one young lady just show me where she was bleeding and how much and show a pad. And I was like, oh, I would not have seen that in clinic. I really like to be, I like having that time with the patient, and I like for them to be able to have that extra privacy to express themselves that they might not be comfortable saying in the office. And with COVID, we've had a lot more mental health challenges. So it's kind of nice to have that one-on-one time. Also, the telehealth allows me to see the family unit. One mom had 5 kids on separate computers in the same room, and I got why she was stressed when she comes to the clinic. That's a lot to manage, and she had to do it through COVID. So, and then the other thing is medicines that they're supposed to be taking regularly. I often say, can you get it for me? If they can't find it, I know it's not as regular as they think it is. In person is always great, but I think there's a space for both. And particularly during this time with COVID is surging, I have found that I have found things out about my patients that I didn't know, that I've been seeing them in the clinic. And I think it's because we had that time, they had the space, and they were comfortable sharing with.
That's great. Thank you. What great perspectives listening to you all talk about the difference in being able to do a telemedicine or in person. And I just from my 20 years at the treatment center, I would have said in person always, but after hearing Dr. Bryant, you're right. There are some things that can happen and through virtual that I would not have thought of. And maybe the best of this later when we're all settled down is that we keep the best of both somehow. So that's really great. Thank you. I have another question. We have a few more minutes left. And this one's about learning how to self-infuse or get injections, how that might work on a telemedicine visit with your team. Anybody wants to jump in?
Well, actually, we've had a couple of bleeds where I had to teach a mom how to do that. We had taught her in person, but with COVID, she was very frightened, and emergency room was a long way away, and she did great. You have to have a good internet, good camera, lots of patience, and be able to see as they feel for the vein, clean, and remind them. It really helps a lot if they've had prior training or prior education. But even without, I think it's something that we've done twice, and to my surprise, it worked great. And so I think, learning a bit, as soon as we can, when we're in person, try to educate, try to make sure that people have the supplies they need. Kids, if they can go to camp, that's a good thing. And then if they've had that practice or at least seen the process, it's not that difficult to talk someone through giving an infusion at home. And it's actually kind of nice because you can coach and support them through and go, well, wait a minute, not too much, that kind of thing, so they can do it. I think Jim is doing that at his treatment center also.
Yes, thank you, Dr. Bryant. So interestingly, sometimes you think that there's things that are the domain that should only be done face-to-face, and that's been completely dispelled by everything that's happened during this pandemic. And we have noticed that, just like you said, Dr. Bryant, there are times when we can do things from a virtual component. I believe it's probably HTC specific, so other HTCs may have their own take on what they do, but we assess each patient for sort of education readiness and then the ability to do what they want to do. And oftentimes, if you've had prior experience, for instance, if we start you on one of the sub-Q medications, and we've had a couple of patients who happen to be have a comorbidity with diabetes, so we know that they already know how to do the injection because they've given themselves insulin. That's an easy no-brainer as far as you can do this over virtual visit. You don't have to come here, but there's always the education piece that goes with it. So we want to make sure that we put an appropriate amount of time with that virtual visit to make sure that the education that we need to give and the questions that the patients have all get done and answered in that same visit. The other thing that I found is, again, that we can do IV education as well. So self-infusions and things like that. We have utilized some of those snippets that you can see on either YouTube or potentially on a manufacturer's website that shows someone how to do a sub-Q injection or how to do an IV infusion. They're out there. And we probably didn't utilize them as much as we did when we were seeing our patients face-to-face because everything was just done right there. But now I can say to a patient, hey, I want you, before you get this new medicine, to watch this video so that when we go to do the education piece with this, you feel comfortable with the process. And then a decision can be made. If you feel comfortable enough and we feel comfortable enough, we can do this virtually, or if you need to and you want us to sort of do everything right in person, we'll set up that face-to-face visit.
That's great, thank you. I have another question here, and I think it might have got addressed during our recorded session, but maybe just to take a couple of minutes and emphasize it. The question is, what should I do between visits? So I think leading to being ready for a telemedicine visit, things that you all would look for, maybe the top, few things to give our people watching some things to take notes on. Would like to go first?
Always have your top 3 questions you need answered. I mean, that's, I think, really a good thing. If you're doing telehealth, check your equipment and your internet. That's really crucial because a lot of times you want to get in and you're stuck and then you miss your appointment. And then number 3, if there's anything that you need for refills or support or any of those kind of things, or if you need supplies, make sure that we're on it and we make sure that we get you what you need. So I think the main thing though is have your goals ready because they're going to be changing through this pandemic and through the life of your disease and through your transition, and we want to be there for you.
Great, thank you.
For me, I think I would say, I'm sorry, Jim, go ahead.
I was just going to add on to Dr. Bryant and just say, I agree. The couple of things that we also want to make sure is that you have kept your bleed logs up to date. Let us know what's happening in between. And also for our young girls and young women who we've given a menstrual diary to take care of, to make sure that you're completing that, because that really does help us. I love the fact that Dr. Bryant mentioned she's been able to do a virtual visit, an actual visual piece that shows the extent that menorrhagia can have for someone. And so from that standpoint, that's great. But I also want you to keep, your menstrual diary for us as well, because we can then check that in the interim. And I agree, again, always whatever forms you need completed, let us know as they're rolling for you so that you're not having to bring them at the next visit when we could have done them in the interim. It's simple. I'm now getting a lot of the school forms for keeping medicines at school. So right now we're heavy with that. But again, I like to get it as opposed to September, October, when somebody's already started school. Now I have the opportunity to do everything ahead of time.
Great.
And I know we're running short on time. So the one thing that I would say, really encapsulating everything, is what's new. Are there any insurance changes? Are there any school changes? Are there any sports changes? Are there any bleeding pattern changes? So I think if we could just wrap that whole piece up, I think for me, it would be what's new.
That's great. We are just about out of time, but I would like to ask each of you, what did you enjoy most yourselves about doing this session together and for our audience? Just a couple of words, and we'll start with Dr. Bryant.
I enjoyed meeting everyone. I always get so much knowledge from Jim, and I just met Gervais, and that was great. And I enjoyed thinking about the process of what I liked and what I didn't like. We have embraced this telemedicine in our HTC. In fact, some of our comprehensive visits, we do telemedicine ahead of time. So when they come in, it's not so long. We've got some things out of the way. So thanks for having me. And it was wonderful to share and to learn from everyone else.
Thank you. How about Jim? You go next.
Sure. Thanks, Ed. I agree. My favorite piece was, of course, this group, because I always learn something and I hear something that people are doing at other centers that I'm like, oh my gosh, we should be doing that at our treatment center. And why haven't we been doing it? I will say the piece that I liked was sitting down and sort of reflecting on the questions ahead of time and trying to make it sound as if what we were giving you guys was the information that hopefully is best for you. In anticipation of that, I was hoping that for sure, if you had questions on anything that you missed from what we might have presented, you can still reach out through NHF, and we'd be happy to take questions post this session at any time. So again, thank you to NHF, Ed, for you moderating, and obviously my co-panelists. I so enjoy working with you. Thanks.
Thank you. Gervais, we have about a minute left. What can you close us with for you on how this was?
I think fellowship. One of the things that COVID has taken away from us as a hemophilia bleeding disorders family is the ability to get together. And so I think really the ability to get together with providers to hear ideas, things that are happening across the country. And then, like Jim said, the ability to give back to the community that we love so much. And so just gives us, it keeps us looking forward to the next meeting that we can have in person.
Well, thank you, panel, for this. It's been a pleasure and honor. I hope we get to do this again, and I'm turning it over to you, Erica.
Thank you so much for you all for sharing your wisdom in regards to visiting an HTC facility. I do want to thank everyone for joining us today. Again, our moderator, our speakers, as well as our chat manager, as well as the co-host today. I do want to remind everyone, we do have an evaluation available. Please fill it out. There is an opportunity to win a $75 raffle gift card for that. You will get an email tomorrow in regards to evaluation. We welcome your feedback to help make BDC 2022 even better. And you do have until August 29th to do so. Thank you all.